Good morning, ladies and gentlemen. Thank you so much for joining us this morning. A warm welcome to Impact Philanthropy Africa's Forum on Health. The theme of our virtual workshop this morning is towards an equitable, resilient, transformative health system in Kenya and beyond. Health is at the heart of the 2030 Agenda for Sustainable Development. It is at the heart of Kenya's Vision 2030, and it's a major priority focus for corporate and private giving in Kenya. So today's workshop is so relevant to inform Impact Philanthropy Africa's agenda on health. We have an amazing lineup of experts who will guide us and break down to us Kenya's progress and context with regards to the health sector. Before we get started, I want to give some housekeeping notes to you. To the right of your screen, you'll be seeing some icons. There is a chat icon, and we want to hear from you throughout this workshop. So please post your comments, your questions using this chat function. Secondly, there is a poll icon. Please take time to fill out the very short poll that we have. We want to hear your thoughts on how you found this forum. The third is a handouts feature. This contains the agenda for today's workshop and also some additional background information for yourselves. Throughout the forum, we will be showing and highlighting members' videos showing their various investments and work in health. We have an amazing lineup of speakers, and so without further ado, let's get started. To get us started this morning, it is my absolute pleasure to welcome our keynote speaker, Madame Susan Mochache, Principal Secretary in the Ministry of Health of the Republic of Kenya. Susan Mochache is a Principal Secretary in the Ministry of Kenya. Her key assignment presently, together with the leadership at the ministry, is delivering universal health coverage, UHC, which is among the Big Four agenda of the government of Kenya. She has previously served in the same capacity in the State Department of Cooperatives, Ministry of Environment and Forestry, and the State Department for Social Protection. Her career spans over 26 years at management level in both private and public sectors. Madame Mochache this morning will be providing us the opening remarks and giving us a contextual overview of the state of health in Kenya and looking into the future, unpacking for us what are the opportunities for private giving and philanthropy in the health sector in Kenya, what are the potential areas for co-creation, dialogue, and collaboration. A warm welcome to Madame Mochache. The floor is yours.
Thank you. Thank you very much indeed. I am pleased to be joining you on Philanthropy in Africa Forum. And the focus particularly being health. I wish to say that even at a very personal level, I was keen to participate because I truly do believe in individuals giving of themselves, whether in terms of resource or in kind, in terms of using their own, because that's how, and it is something that is indeed close to my heart. The Ministry of Health fully supports efforts of philanthropists, which have immensely contributed to improving the quality of life for the majority of Kenyans. It aptly captures the role of philanthropy in our lives when we say philanthropy is not about the money. It's about using whatever resources you have Bill and Melinda Gates Foundation's contribution in our country would agree that most of the gains that we have realized in the war against HIV and AIDS have arisen through prudent use of resources graciously donated by the foundation to Kenyan government, as well as other foundations and support institutions such as the Global Fund, the Clinton Foundation, and many others who have made a tremendous and continue to make a. When the COVID-19 cases were reported in our country, various local and international philanthropists quickly moved in to collaborate with us in government to step up our efforts of mitigating the impact of the coronavirus. For instance, one of the very initial donations were received from Jack Ma, an entrepreneur, a businessman in China, as well as a well-renowned philanthropist who not only contributed test kits and PPEs to Kenya, but also to the entire African continent right at the beginning of the pandemic. And he really did provide a major boost to governments in the containment measures against COVID-19. Locally, you all really do remember how our corporate significant that were used to support the national response to COVID-19. Many will remember that the frontline public healthcare staff handling COVID-19 patients received personal protective equipment, psychosocial support to help them cope with the challenges of dealing with COVID, and all this was thanks to the resources that were mobilized by the fund. I must really recognize the important role that fund plays to provide the support to various the Equity Group Foundation, the Kenya Commercial Bank, East African Breweries, Safaricom Foundation, the APSA Group Limited, amongst many others that stood to be counted as the country sought emergency measures to protect people against COVID-19. Should I have left out any other corporates, and there were many even small businesses, small NGOs, please let me be forgiven because the list is very long. Besides, the Kenya Private Sector Alliance, which is CIFF, have also stepped in this phase when we are now focused on vaccinating our people against COVID-19 with the aim of achieving a herd immunity that will allow us to be able to continue operating as normal and having the economy fully open through ensuring that we have attained at least 60% vaccination of our population or the target group. And KEPSA has been able to come together and been able to support our vaccine acquisition efforts and have been able to import so far 1 million doses of vaccine through the government. And is in line with the long-standing African culture, which we popularly call Ubuntuism. Here in Kenya, we have for a long time called it Harambe, and that has for many years meant a positive human interdependence for survival. Why I found your invitation irresistible, given that our ministry long-standing partnerships with various philanthropies that have made it easier for us to be able to run and provide various health programs for our citizens. I must therefore thank all the current 20 members of this forum, and I am very humbled to be joining you because of, in one way or another, you have indeed contributed to the immense progress that our country is making in taking care of people. As a Ministry of Health, everything that we do right now is seeking to achieve universal health coverage in the face of this current pandemic. Indeed, the goal of this forum, as we realize, is to build a culture of corporate social investment and influence policy through advocacy and through leadership. This is extremely commendable, and I'm proud to be associated. No one of us can deny the fact that philanthropy is a space, a medium, and a vehicle through which people are able to extend themselves to others in society. It also brings people together in their quest to advance common causes in human advancement, as are very well illustrated in terms of the support that we receive and presently as we speak. We have the African Vaccine Acquisition Task Force, or Task Team, which was set up by the African Union chairman, who is currently President Ramaphosa of South Africa, with the aim of mobilizing vaccines for our continent. For the national seeing globally that have left out many developing countries, including ours and the entire continent, in accessing vaccines. The Advanced Task Force has been championed by African renowned businessman and philanthropist Charles Masiwaya, and it is targeting to support countries with the resources to enable the purchase and deployment of vaccines for up to 400 million people in our continent by the year 2022. This and much more will only be possible if all philanthropists rose to the occasion to offer support. And I really must use this opportunity to thank Strive, because I work closely with teams. We sit with teams in meetings, negotiating with the COVAX facility. We sit with teams negotiating with manufacturers for special considerations for Africa, and he has put in his time and used his talent and ability to negotiate and to network in trying to help us access vaccines. And indeed, this evening, with what I started off with, a quote from Belinda Gates, that it is not just about money, it is about being able to use what is at your fingertips to make a difference for humanity. Therefore, to explore ways resilient health systems through goodwill and support of organizations like yours. I wish to assure you that the government will relentlessly continue to provide a good environment for philanthropy to thrive, including through guaranteeing tax waivers for areas that support that we have received during this pandemic, where tax waivers have been extended for all the commodities that were touching on other commodities beyond COVID. We believe that this is the best way through which we can effectively achieve the government's broad health objective of ensuring that all Kenyans access quality and affordable health care without suffering financial setbacks. We are determined to reduce the country's disease burden and spare our citizens the heavy medical bills arising from hospital expenditures on various diseases which you all very know of, whether it is malaria, whether it is pneumonia, whether it's a great country. Indeed, provision of quality healthcare is really the core in His Excellency President. The government is determined to make the universal health coverage a policy priority in the country. And you may be aware that His Excellency, the President, set this agenda in 2017 to ensure that all Kenyans by 2022 will be able to have access to affordable and quality essential health services. And you may ask yourself how we will do that. In order to fulfill the UHC agenda, we initially focused on robust health system strengthening of our county and specifically public facilities to ensure we were able to provide various support in terms of closing the gap on medical commodities, which were just about limited resources to close gaps on human resource. Of course, we are not there yet, but we were able to recruit about 9,500 health workers and who are deployed to all the 47 counties to focus on providing service in our level 2 and level 3 facilities, which, as you know, are currently and have been for a long time understaffed. We also plugged in our HR gaps by bringing on board 4,000 universal health coverage interns to offer service. One, to also give them an opportunity to get work experience, and especially to also offer themselves to meet the gaps that exist. We've also endeavored to provide at the diagnostic level so that we can be able to ensure that facilities at the community level are able to do basic diagnosis. We also invested in community health volunteers. We have capacitated over 66,000 community health workers, skilled them even on emerging issues such as mental health, issues to do with non-communicable diseases, early diagnosis of high blood pressure, cancer, etc., so that we can also drive the agenda of preventive rather than promotive health. Having done that, in close counties will continue to know health is a devolved function. We then move to prepare ground for the UHC insurance scheme. And we are now rolling it out. The insurance package is costed at 6,000 shillings per household, and it is a cover that is able to provide the beneficiaries access to essential health services, including issues of mental health, which I must talk about because it is a serious matter that we are facing as a society, dental surgery, cancer treatment, both radiotherapy and chemotherapy, other surgeries, diabetes, dialysis, and all other ailments that a person would have and would need to get treatment for. And even for those particularly in the eastern side of the world, easier to be able to have some of our Kenyans the country. So the UHC insurance scheme is meant to cushion the poor households from the high cost of accessing medical services and spare the families the pain of borrowing money, including getting loans, selling their assets. We know people sell land, people sell their cows, and really the people end up being impoverished when certain illnesses hit their families. So we have now been able to roll out the first phase of the UHC insurance. We enrolled 1 million households in the year of 2020. 6 billion shillings is to be disbursed to cover this household. The overall target we have 5 million poor and vulnerable households. So we have only just begun the journey. So at present, we are at 1 million. This financial year, we shall be increasing by 300,000, and we hope that by 2022, we will be looking at covering at least 2 million households, and the journey will continue until everybody is covered. You may ask, what about those that are not within the vulnerable households? We've done legislative amendments to the CIFF bill to make it mandatory for anybody that should be able to implement formal sector, individuals who are involved in farming, and many others who work in the entire transport sector, who can afford to pay 6,000 shillings for their families every year to make sure that they are cushioned from any financial burden arising out of a health crisis. Since we have institutions that are big players in philanthropy in this field, I wish to call upon all of you to collaborate with us and to shore up and strengthen the UHC agenda to move forward. This will supplement our national efforts in the agenda. And as you are aware, we are also still busy managing the COVID-19. But it is here. COVID is not going anywhere anytime soon. We are looking at having COVID with us for another 2 to 3 years. But all of us also recognize that our government has made great efforts to mitigate the impact of the coronavirus in a manner that has reduced deaths and also hospital admissions. As I said earlier, we are now engaged in aggressively vaccinating the targeted 10 million Kenyans by the end of this year. And indeed, we are confident that we are on track because so far we have immunized about 4.5 million Kenyans. Our efforts to do better on this scale were slowed down by our inability to access vaccines internationally, as you are aware, although the situation seems to be improving. But it's with us to scale up the vaccination process through acquisition of vaccines and also supporting us in mounting a robust advocacy strategy to beat the existing hesitancy by some Kenyans. I would also wish to appeal for your consideration and support in mobilizing communities, mobilizing people to come out and get the vaccine. Therefore, I want to today welcome you to work with us in government and particularly in the space of health to ensure that we achieve our aspirations that are well encapsulated in our universal health coverage agenda, our Vision 2030, as well as the Sustainable Development Goals. We are eager to discuss to ensure healthy lives. I wish to also just recognize very quickly that I sit in the board, the Global Fund board, and I also am the chair of the African Bureau of the Global Fund. And it is becoming increasingly clear that we must begin to dig into our own resources, particularly for our continent, Africa. And indeed, at the African Bureau, we have agreed that we are going to aggressively begin pursuing resource mobilization from our key philanthropists who really are missing within this space. If you look at the globally renowned philanthropists that I mentioned, they all contribute either directly or through vehicles such as the Global Fund and others that support various we rely on donors to support us, especially on our HIV, our TB and malaria efforts to the tune of 80% of what we require. When we look at issues of family planning, which are also crucial because they also touch on maternal death and maternal infant mortality and also affect the planning of our country, we are totally dependent to the tune of almost 90%. What does it mean? It means that we really, as donors begin to withdraw funding because of the change of our income status from a lower income country to middle income country, where donors will just gradually withdraw for that very fast, we need to give in more to our resources. And the government itself is making every effort to money. But as you can see, the burden is onerous, and especially with the emerging health issues such as this pandemic, and we expect to see more because of climate change and other global issues that are affecting the issues of public health. So it couldn't be a better time for us to really weigh in and dig deep into see how we can support the health sector, because it shall continue and is critical to everything that we do and to our very own existence as our country, as a people and as a country. You have seen the devastating impact of COVID. Businesses have closed. Businesses have slowed down. Families have lost their livelihood. So health is everything. For choosing to have health as the point of focus in your discussions in this annual forum. Thank you very much for your attention, and I look forward to our continued collaboration and engagement as we move forward. Asanteni, and thank you for listening to me. And I wish you a successful discussion today.
Thank you so much, CS Mochache, for those opening remarks and for giving us such a detailed overview of the state of health in Kenya and providing us further context on how the philanthropic sector can complement government's efforts. We thank you for taking time today. We know it's a busy morning at the Ministry of Health, so thank you for honoring our invitation to be our keynote speaker and those opening remarks. Ladies and gentlemen, as we move on, let us briefly watch some video highlights showcasing Impact members' programs and investments on health.
Globally, we're all fighting an unseen enemy, and everybody needs to do their bit. Each individuals, governments, and also the private sector. And so with Kilifi County, we are partnering today with the KMPDU as well, and they are the organisation that are helping with the distribution and the monitoring of the equipment. And the monitoring of the equipment, how it's being used, is very, very important, because we need to ensure that it's being used properly, it's being used in the right places, and also that we start to understand the benefit of it.
So what we have received today, among others being the PPE kits, we have goggles, we have masks. All these will go a long way in equipping our health workers to serve in a safe environment. We also are looking forward that with this equipment, we shall also reach out to the communities, not just issue these for their use, but also educate them on how best to use and get best results out of it.
Such a partnership with Safaricom goes indeed a long way, a very, very long way. Not only in just in terms of provision of the utilities, the non-pharmaceuticals, but also in morale boosting and in ensuring that the frontline health workers, whom I represent in KMPDU, are well motivated and that they're in line to doing what they're trained to do without necessarily having to worry about getting infected themselves or transmitting the infection to others.
So we wish to return our gratitude to the partners for really extending this gesture to us, and we shall remain committed to the cause and make sure that this assorted equipment shall realize and be applied well, made best use of to get us the best outcomes from that gesture.
Thank you very much to Kilifi County and also to the KMPDU, and we look forward to extending this program into other counties over the next few weeks.
Christina Law. I'm a community health volunteer. So when I do the home visits, I have to educate them, screen, refer, then report. Chenye napendelea kwa kazi yenye nafanya ni vile tunaimarisha afya ya wakaaji wa area yetu. Simu inafanya kazi inakuwa easier. Hatubebani na ile mrundo ya vitabu. Simu pia inatuelekeza, inatupatia mwelekeo. Tumechukua temperature ya mtoto, tumeona imetoka ngapi. Haya, simu itakwambia kama uko supposed to refer or you are supposed to treat.
Ni mzuri kwa sababu unajua vitu wana record kwa simu, hata wakikuja wana kuangalia, wanapea kazi rahisi kuliko kitabu. Unajua bado wanataka kuweka vitabu, kutafute jina penye iko, lakini unajua simu naye inakuletea haraka, inawapea kazi rahisi.
Community health is really vital in Kisumu County. Now that we went digital, we are able to monitor what is happening at the community level as well as the sub-county level and make amendments where necessary.
My role is to supervise community health volunteers. I also coordinate with the community members to influence their behavior in health seeking. The use of these digital tools to gather data has improved our work because we now have real-time data. So this one has also influenced our decisions, that we make decisions quicker than there before. When I want to do a supervision, I'll look at the CHV follow-up and pick on those CHVs that are not meeting the targets or are having challenges. Then I go and supervise them.
I would like to appreciate Kisumu County government and Living Goods for having this dream of digitization coming into reality.
መስተጓጎሉ አልቀረም አልተስተጓጎልም ስራው እየተሰራ ነው ነገር ግን ያለፋል ሰዎች እጥቃቸውን ጠብቀው የማድረግ ስራ ማስክ እየለበሱ እንዲገቡ የማድረግ ስራ ለመስራት ለኛ ስራ ጫና ያለው እንጂ ስራውን አላስቀረም አሁን እኛ የበሽታ መጣ ብለን ቤታችን ብንቀመጥ ይሄ የማያውቅ በህብረተሰብ እንዳለ ነው የሚያውቅ ስለዚህ እነሱ ከሚያርቁ እኛ ራሳችን ጠብቀን ባለችን ዕውቀት ለህብረተሰቡ ቅና እየሰጠን ለህብረተሰቡን እያስተማርን ራሱን እንዲጠብቅ ማድረግ አለብን ይሄን መስራቱ በራሱ ለራስ ተደስታል የሚያውቅና ማሳሳው ጋር ራሱን ከበሽታው እንዲጠብቅ ማድረጉ ያስደስታል ስለዚህ እኛ በበሽታው ተከተን ቤታችን ተቀምጠን እነሱ ከሚጎዱ እኛ ራሳችን በምንጠብቅበት መንገድ ራሳችን እየጠበቅን ህብረተሰቡን እያሳወቅን ከበሽታው ራሱን እንዲጠብቅ ማድረግ ስራ መስራት አለብን ብለን ራሳችን ከዚህ ስራ እየሰራን እንገኛለን
Our next speaker is Dr. Rispah Walumbe. Health Policy Lead at Amref Health Africa. Dr. Rispah will be giving us a regional perspective on what we are learning across Africa, and particularly in light of the COVID-19 pandemic, and what is some of the advice, seeing the emerging key issues and trends in the region, that we should pick up in order to make philanthropy or CSI more strategic with regards to healthcare financing and service delivery. Dr. Rispah Walumbe is a global health specialist with a focus on healthcare policy and financing. She embarked on her global health career as a medical doctor, where she served as a senior medical officer in the public sector. She has worked predominantly with vulnerable populations in rural and low-income urban areas in Kenya. She's a public health researcher and an advocate for improved access to quality healthcare services through UHC. She has supported, trained, and mentored over 200 healthcare workers across Kenya in emergency obstetrics and neonatal care services, and trained over 100 public health practitioners in healthcare policy. Her recent portfolio includes leading the Secretariat for the National Hospital Insurance Fund, NHIF, health financing reforms in Kenya through universal health coverage through the Ministry of Health, and lending her technical expertise to the organization and coordination of the AHAIC Commission on the State of Universal Healthcare in Africa. She is currently working as a head health policy advisor in the executive office at Amref Health Africa headquarters. Dr. Rispah, a warm welcome to you. The floor is yours.
Good morning, ladies and gentlemen. My name is Dr. Rispah Walumbe. I work as a health policy advisor at Amref Health Africa, and on behalf of the Amref Health Africa family and, of course, the CEO, the group CEO, Dr. Githinji Gitahi, I would like to take this opportunity to thank you so much for the opportunity to be here. And I also would like to acknowledge the work of the Kenyan government, specifically His Excellency the President, the leadership of the Ministry of Health, and of course the government as a whole in terms of their efforts towards battling the pandemic. So I look forward to engaging with each and every one of you, and I hope we can come out of this presentation with a lot more to discuss and a lot more action points. Thank you. So I'll just jump right into the presentation. Thank you so much for your attention on this. So as I said, my name is Dr. Rispah Walumbe, and I work for Amref Health Africa, and I'm going to take you through a couple of the lessons from the region when it comes to COVID-19, but also in terms of, the progress the healthcare system has made for the region, but also for some individual countries as well. I will start off this presentation with emerging issues, but I think I wanted to emphasize the importance of really looking at this in a three-tiered process. So first of all, we have emerging issues. So this is what have we learned, what have we seen as a result of the pandemic, what has changed for the healthcare landscape. And then I will go into kind of like the opportunities that we've seen arise as a result of the pandemic. And I think it's critical for us to not just look at the challenges we've had, but also identify opportunities that we can leverage as we move forward. I think this is particularly important to us, as we start to consider how to weave our way through the recovery process as a region. And then finally, of course, I'll look at some next steps and really identify the key issues that we can start to focus on and hone in on those major issues and tools that we can leverage so that we have very concrete action points. So when you look at the emerging issues, there's quite a number. And of course, I wouldn't be able to exhaust them at this stage. But I want to start with something very critical when it comes to the impact this pandemic has had on healthcare, on the economic and social sectors, particularly in the context of recovery. I wanted to, first of all, start with the fact that society is actually made up of people. They're not made up of economic infrastructure. They're not made up of, the environment. Really, the society is driven by people. And when you look at the impact this has had, the pandemic has had over the past 1 year and 7 months, people have actually lost their lives. people have lost family members, people have lost, we as a society have lost healthcare workers, and many more that we can't be able to mention in this short amount of time. But I think I also want to emphasize the fact that people have actually also lost livelihoods. And until today, 1 year and 7 months later, a lot of families, a lot of people are yet to recover from that process and that impact. Additionally, of course, when you look at different sectors, particularly the social sector and more specifically the education sector, you have had significant differences in terms of access to education, and you have further exacerbated the inequities that existed. So you'll find families with from low socioeconomic backgrounds have had limited access to education, and right now we're in the process of playing catch up. And I think that's something that we won't be able to see all of these long-term effects. There's so many dire consequences that that we can see that are already occurring. But when you look at this from a long-term perspective, I don't know if we'll be able to truly grasp the extent of what this pandemic has done to our society. That's in terms of the social sector. When you look at the healthcare sector, there's actually quite a bit as well that has happened. When you look at the programmatic work that we've been doing, we've actually had a reversal in some of the programmatic work we've been doing. Because of limited access to care, as a result of some of the measures that we've had, a lot of our indicators have dropped, but in some cases they've also increased. In terms of where we have managed to leverage, whether it's technology or different innovations to be able to increase access. But at the same time, while we increase access, when we increased access in some areas, we actually regressed or eliminated access in others. And that's something we really have to recognize and really identify whether the design of our health systems is responsive to the people that it serves. I think beyond that, of course, I won't belabor the point about the effect it's had on economies and, across the region. But I will say that one of the emerging issues that has come up as a result of the pandemic is the importance of multi-sectoral action. And I think there was a very important display from the government of Kenya and governments across the region in terms of how they collaborated as from different sectors, with the healthcare sector playing a lead role. And I think it was very critical for us to recognize this, because as we have discussions around, the design of health systems, around things like universal health coverage, which is still really critical, we really do need to understand that as we move forward, multi-sectoral action is not just in the face of pandemics. Multi-sectoral action is critical in the process of thinking through how we design our health systems, how we think through what our challenges are. And, of course, some of the challenges we're experiencing right now is around manufacturing, is around access to vaccines. And I think it's really critical to understand how do we actually collaborate across sectors, not just for innovation, not just for manufacturing, but many other things that I think would be critical to always underline the importance of multi-sectoral action. When you look at the impact clear leadership had in terms of, how we communicated to the people. Remember, our societies were facing something that hasn't occurred in very many years. And I think the impact, of course, of COVID-19 was that it was far-reaching. And the importance of clear leadership, both at the country level, at the national level, at the county level, and even as we go high to the regional level, was really critical in terms of having a consistent voice, a consistent thinking process, and a very clear message on what needs to happen. Because the importance of having clear leadership or having really good stewardship in this process is actually what drives more coordinated and succinct action, so that the response is swift and effective. Now, the final emerging issue is that when you look at our healthcare systems, is that there are 3 levels when you look at a pandemic, and you also look at any other, shock to the system, so to speak. This doesn't necessarily have to be, of course, a pandemic, it could be a drought, it could be a war, it could be many, many, many things. And I think one of the things you have to look at is these 3 steps. So the first step is preparedness, second step is adaptability, and then the third step is execution. And I think why I put adaptability before is that we need to have a very clear learning process, because we have to make sure that, one, we are prepared, because now we've always known that this is a possibility, but I think these systems were kind of created in the era, in an era that was really not, I would say, well aware of what is going on. And I think it's critical for us to understand, how do we keep revising our preparedness for shocks to the system. And then the second thing, of course, is adaptability. We need to be able to adapt. So what happened 15 years ago with our preparedness model might need to change. What has also worked 15 years ago might actually still be applicable now. So we have to be able to adapt and shift when need be. And I think there are really important lessons that were learned by countries during this process. And that was, of course, around having to shift and adapt, because we were dealing with an enemy that we could not see, we could not touch, we could not, strategically attack in the traditional sense. But this was an enemy that really was emerging and changing. And as we continue to go forward, the enemy continues to change. And I think that's why, of course, you can see why the conversation around vaccines is so critical, and how vaccine equity is something that even through the discussions at the Global COVID-19 Summit, we were very adamant in saying vaccine equity is first. Vaccine equity is really at the core of tackling this pandemic once and for all, and then continuing to build resilient health systems. So now I'll move on to the opportunities that we have. Now, when you look at the opportunities, I'll segment them in 3 ways. One of the things that has actually, again, emerged as a result of this pandemic is people are starting to reevaluate how we look at health systems, how health systems are responding to the needs of the people. Because remember, in the face of the pandemic, it wasn't only people who were infected with COVID who needed access to care. We still had people who needed access to care for non-communicable disease, for communicable disease, and many other ailments that don't fit in those 2 kind of brackets. They still needed to be able to access care. And the way we looked at how we designed our health systems brought us to the point where we started to question. We even started to question the point where, how are we accessing commodities for healthcare? Because during this process, accessing some of these commodities, from testing to treatment modalities, the prices of these things were skyrocketing because, one, we already had a system that was not necessarily equipped to be able to do this for itself. And then secondly, it was also relying on pricing mechanisms that were, for lack of a better word, we had no access to influence that pricing mechanism, because we were in the space where we were competing, and we still are, in the space where we are competing with high-income countries for the same commodities. And this is where it really triggered a response within the African region and within specific countries to really reevaluate how we think through our health systems, how we think through what resilient health systems mean, and how we can move forward. Now, additionally, other opportunities that arose was, of course, the appetite for the uptake of innovation. Now, when you look at uptake for innovation, we looked at ways of increasing access to care. Remember, I'd mentioned this earlier. We made sure that we utilized all the tools at our disposal to be able to make sure that people still had access to care. And I know there are quite a number of innovations from the private sector, from the public sector, that were initially proposed and that actually carried on even thereafter. And I would just think of course, certain examples such as a call center and being able to call and make those reports. And, beyond the call center, also looking at how we were making sure that women had access to care in terms of maternal care and things like that. And I think one of the things we really need to think through is, how do we sustain these interventions beyond what is existing? So when you look at the appetite for innovations, I think that in the era of COVID-19, and I think even before, we had already started to see how innovations were increasing access to care, delivering on efficiency, and also enhancing quality of care. And I think that's something that we do definitely need to carry forward as we move along. Now, when you look at this, we really need to figure out how some of these innovations can be sustained or utilized in a way that makes sure that we're looking long term. We're not just looking at the temporary situation. We're looking at how to adapt for the longer term. And again, the way that we can make sure that these innovations fit into a health system that is effectively designed for the people that it is meant to target. So when you look at some of the innovations that we saw as a result of this, I think one of the great innovations that we saw, of course, was the call center that was making sure that we were able to coordinate and see how COVID-19 reports were coming in, some of the challenges that people were experiencing on the ground. And then we also had innovations around making sure women had access to maternal care, by making sure that we had women within the the larger environs of Nairobi being able to access maternal care by through a transport mechanism. Now, those partnerships are extremely critical, and I think that's why I keep saying that as we look at these innovations, we must identify a way that these innovations can be grown to the point where they can be sustained. And I think that's really the key message here. Now, when we look at the third opportunity that I think is really critical, and really, if there's nothing else you hear me say today, this is what I want you to take home, is that there is regional commitment to self-reliance and resilience. Now, why is this extremely critical? Is because one of the things we have seen as a result of this pandemic is that at the beginning of this pandemic, we stood alone as a continent. We stood alone as a region. And it was extremely difficult to be able to navigate the situation when it came to access to vaccines, access to PPEs, access to testing kits. We really were in a situation where we were, I would dare say, almost begging high-income countries to really, give us almost like their scraps. And so one of the things that the region as a whole has done, of course, through the African Union and of course through the African Union Commission on COVID-19, which is of course chaired by His Excellency Cyril Ramaphosa, is that really we're looking at how do we make sure this doesn't happen again. And when we look at even the next steps, where we'll talk about how do we structure our investments in a way that they leverage on the health financing system and make sure that there's service delivery. One of the biggest things I will say is that right now is the time for us to advocate around this self-reliance, around this resilience, around how we can be able to equip ourselves beyond the reliance on high-income countries. Because I think it's important for us to make sure that we learn from what has happened over the past 1 year and 7 months. It was quite dismal in terms of people being able to access vaccines, where we are still at a very low vaccination rate, and partly mostly as not as a result of our own fault, and where we have, I think, approximately maybe 3%, maybe 4% if I'm being generous, of the population in Africa having access to vaccines. And that's one of the things that I think is a really indicator of why this point is extremely critical. Why we need, when we talk about manufacturing, let us talk about manufacturing in a very concrete and long-term discussion. Because we cannot only look at vaccines as the current, because that is a current problem, but in 5 years, in 10 years, when we are in a situation where we need to be able to access care, access commodities, are we able to, collaborate with our neighbors within the region to be able to access those commodities, and not just access them at prices that are more, that are more, at a more, I would say, I think the word is at a cheaper price, right? Because we want to make sure that we're able to really utilize the resources that we have available in the most effective way possible. So what next? Or, really, what are the next steps? Now, when you look at the design of the health financing system as a whole, you have, of course, the three key areas, right? So there's resource mobilization, where you collect all these resources. And then next you have the pooling of these resources so that you have a more efficient and effective pool. And then finally, you of course have the purchasing of particular services, goods and services that are, and the overall goal of these three steps is to make sure that you have an equitable, efficient, and effective health financing system that really pushes equity for universal health coverage. Now, when you look at health financing and you look at service delivery, those two go hand in hand, because one is facilitating another, and one informs the other. So when it comes to the prioritization of our investments, our strategic investments in the health sector really need to focus on, as I said, self-reliance and resilience for our healthcare systems. And I cannot say which specific areas must we invest in, because why? The second point is actually emphasizing that the best advice I can give in my perspective is we need to focus on long-term impact investments. And then we need to make sure that we are guided by the approach that governments have identified and can carry to fruition. Because when you look at those investments, when you look at how we design our investments, how we design our collaborations with each other, we need to make sure that these are very clearly intertwined with the government approach, with what is deemed as a priority, and what are the quick accelerators that can actually sustain themselves long term. And when we're guided by those two principles and the first principle above, then we can decide on the particular investments that we think are critical. Additionally, I would like to say that it's really important, again, because of the regional fire that is burning currently, it's really important for us to engage our regional mechanisms. And we have currently, of course, seen strides that if you had looked at this 2 years back or even 5 years back, the advancements that we've made as a result have been almost, shocking, because people have been able to look at, for instance, the Africa Continental Free Trade Agreement, and ratifying that was a very big deal. And when you look at the new public health order that the region is looking at, it's really critical for us to tap into that, because I think those priorities, as we prioritize as a region, we can be able to see different leverage points for different countries. So we really need to leverage on our strengths as a region and really tap into those mechanisms. Now, finally, when you look at how we advocate and you look at how we prioritize, let this be our focus. We must focus on reversing and even eliminating inequities. Because right now we are in a world where over the past 1 year and 7 months, at an individual level, at a community level, at a country level, and at a regional level, there has been really significant inequities that have been, perpetuated as a result of this. Really, as a final point, I think as we look at our advocacy, as we look at how do we collaborate, because I know one of the really huge priority areas for the Impact Philanthropy team is really looking at how do we advocate for more significant change, more sustainable change. We must focus on one thing, and that's really focusing on reversing and even eliminating healthcare inequities and inequities as a whole across different sectors. Why do I say that this should be our advocacy, the pillar of our advocacy? Because over the past 1 year and 7 months and even more, we have witnessed the exacerbation and the highlight of inequities across all levels. At individual level, where you have people who are living in low socioeconomic circumstances, having significant disparities from those who are in high income or middle income. You have communities because by virtue of where they are, by virtue of what they do, or so many other things, they have experienced inequities. We have countries that, because of their their income status, they've not been able to tap into or access or even be given a seat at the table because of where we're located, and that's an inequity. And then again, at a regional level, we have been disenfranchised almost because of how we are in terms of how Africa as a region, in terms of being able to sit at the table where decisions are actually being made that impact our lives and our livelihoods. We are not allowed to sit on those tables, or we are not deliberately put on those tables. And I think when you look at those inequities across those 4 levels, then you will understand why our advocacy efforts really need to focus around that. And again, really just to emphasize, when you look at vaccine equity as a really good example, we are still in the point where we have only 15% of donations that were given for vaccines have been actually dispersed, compared to the 85% which we're supposed to receive. And if you look at the level of the vaccination rate within the region, we're still at 3%. And what does that mean? What does that spell? Well, other countries have been able to manage 60, 70, some of them even 80% the population being vaccinated. And instead of considering making sure that they're delivering on certain on their doses, they're letting these doses either expire, or they're looking at giving booster shots against actual advice from the experts, the people who have this, who know about this. So in conclusion, I think one of the things that we really need to focus on is how do we collaborate as a region? How do we work together? How do we really look past what we have experienced over the 1 year and 7 months and even more? How do we look past this in terms of making sure that it's not just vaccine equity we're talking about, but we're talking about equitable health systems. We're talking about making sure people have access to really effective care, and that care is of good quality. We really need to make sure that we're collaborating together. And I think we need to learn from the fact that we actually managed to succeed because of all our collaboration. We managed to, get our heads above water from this pandemic as a result of our work together. So I'd like to thank you so much for the opportunity again to be here, and I look forward to the conversations and the Q&A session. Thank you so much.
Thank you so much, Dr. Rispah, for that regional perspective. As we move on, let's just take a minute to watch some more video highlights from members showing their programs and investments in health.
Hello, my name is Dr. Carol Waweru, and I'm the Foundation Manager at Gertrude's Hospital Foundation. Gertrude's Hospital Foundation was established in 2010 by Gertrude's Children's Hospital, and we provide free quality medical care to needy and vulnerable children throughout the country. On average, we attend to 16,000 children annually, and these children are drawn from various parts throughout Kenya. Gertrude's Hospital Foundation operates under 3 main pillars. The first pillar is healthcare, and under this pillar we provide free medical care to needy and vulnerable children. We have several programs such as the repair of cleft lip and palate for children. This is a congenital condition where children are born with a malformation around the mouth. Also, we have programs around children with special needs. So we provide physiotherapy, occupational therapy, speech therapy to children who have cerebral palsy, Down syndrome, and other developmental disorders. We also provide free hearing aids to children with hearing impairment. We also provide free surgical care under our Harambee Kiss program to children who need urgent care but are unable to afford. We also have our outreach program where we have our Githogoro clinic that provides subsidized care in informal settlements in Nairobi. and many other programs that actually run under this pillar. We also have our education pillar. This is where we train healthcare workers in pediatric courses. We have our pediatric nursing and pediatric critical care nursing program, where we train nurses from all around the country, and these nurses are drawn from the public sector in the various county hospitals. We also train pediatricians in endocrinology. This is training in hormonal disorders such as diabetes. And so far we've trained over 59 pediatricians throughout Africa. And also under the training program, we also sponsor healthcare workers in short courses such as HIV management. Our third and last pillar is on capital projects. So we work hand in hand with Gertrude's Children's Hospital to provide funding in capital projects such as the Chandaria Medical Center that we were able to fundraise from various well-wishers, as well as equipment and in the setup of specialized services to attend to children throughout the country.
Jina ya mama anaitwa Shamsa, mtoto anaitwa Sabrin. Sabrin alipata sukari akiwa na miaka 5. Sasa ako na miaka 8 na ako nayo almost 3 years. Alisema kwa muda alikuwa anatumia dawa. Mara ya kwanza alikuwa amepata shida for 2 years. Baada ya miaka 2 pia organization ndio ilisikia kwa inawasaidia watoto. Sukari ya mtoto pia ikaanza kukua manageable na akapata dawa ambaye anaweza pata kila wakati. Mara ya kwanza hakuweza kununua, lakini sasa anasema anapata dawa kwa nini bila malipo na mtoto yake anaendelea mzuri. Kwa vile tunapata dawa na mahitaji ya mtoto kila wakati, angefurahia sana akipata tena kwa hii kliniki ambayo imefunguliwa leo for 24 hours. Kila wakati mtoto sukari inaweza panda ishuke, aweze pata mhudumu mzuri ambaye ako available kila wakati. Tunashukuru sana Safaricom Foundation ambayo wametuletea dawa na mahitaji mingi ya watoto ambayo wako na shida ya sukari, na tunasema asante kwa Mungu ambaye ametuletea Safaricom Foundation ambayo wametusaidia na tunafurahia sana.
We totally appreciate the work that Safaricom is doing as part of a private-public partnership. As of today, we have 130 diabetic patients who are registered from the data that we have for the entire county. Before this diabetes program was initiated, patients had only access to very limited medication.
The most important resource at KTDA is its human resource that cascades to the bottom of the tea production pyramid. The health of our farmers is key, and this forms part of our key pillars in the tea production chain. We aim to improve the health and well-being of smallholder tea farmers and their communities at large.
My name is Sudibiko Matara. I'm the head of KTDA Foundation. KTDA Foundation is the arm that deals with corporate social investment for the KTDA group. And for us, the health of the farmers is a very critical component in our business. And that is why KTDA and KTDA Foundation have invested heavily in programs that deal with nutrition, the health of our farmers. And one of the things that we look at is the health system strengthening. And we focused more on human resource for health. And that is where we're doing capacity building for our community health volunteers and some of the health workers at the health centers. Because they've acted as the nucleus through which we are able to pass messages, we're able to mobilize and teach on different areas.
Of 1 or 2 nutrients in a certain substance. For example, you fortify flour fortified, sindio? Imefortified na nini? With what? With iron. Alafu we have oil. Oil imefortified na nini? Oil is being fortified with vitamin. Food fortification is one of the strategies. So let us prepare for a pregnant mother. So for a pregnant mother, in the morning, the first thing you will take.
TDA, the health of our farmers is very crucial because productivity of our business depends on the productivity of our farmers. And if our farmers are spending more time, taking care of themselves because they are sick, then that affects their productivity, and as a result, it also affects the productivity of KTDA.
Thank you so much, Dr. Rispah. Our next speaker is Ms. Leah Kibe. Ms. Kibe is the Director, Co-Funding and Partnerships and Head of the Kenya office in the Children's Investment Fund Foundation, CIFF. Leah is a development finance specialist with experience in international development, public and private sector development across sub-Saharan Africa and Asia. She's passionate about the catalytic role of development finance. Leah has been involved in strategic program ideation, leveraging finance models and performance effectiveness of some of the most transformative development programs to expand promising social impact investments across sub-Saharan Africa and beyond sustainably. While serving at KPMG, Leah was a fund manager of the County Innovation Challenge Fund in Kenya, funded by the UK government to support Kenya's efforts to reduce maternal and neonatal mortality in selected counties. Her sector experience includes conceptualizing and delivering financing and technical assistance approaches to improve social and economic development outcomes in health, in agribusiness, in financial inclusion, climate resistance, in governance and accountability, while mainstreaming special interest groups such as youth, women, and adolescent girls. This morning, Leah will be giving her perspective and the CIFF perspective around philanthropic perspectives on health sector investments. She will be sharing with us, through the CIFF experience, what are some of the learnings to date as a major philanthropy, and what are some of the challenges and best practices in this area that are important to highlight. And more importantly, looking forward, where are the opportunities for further co-creation, creating maximum impact and return on investment in health? Ms. Kibe, it's a pleasure to have you at today's forum. The floor is yours.
Good morning, everyone. I'm delighted to be part of today's conversation, and a big thank you to the Impact Philanthropy Africa and its members for this great opportunity. My name is Leah Kibe, Head of Kenya Office at the Children's Investment Fund Foundation, and I also lead the core funding and partnerships initiatives at the foundation, covering our Africa region. So the Children's Investment Fund Foundation, we are an independent philanthropic organization with offices in Addis Ababa, Beijing, London, Nairobi, and New Delhi. We have been working in Africa for over 15 years now, and the Nairobi office has been in operation since 2009. And in 2019, we opened our offices in Addis Ababa, Ethiopia. So established in 2002, I must say we have no religious or political affiliation. We work with a range of partners and basically seeking to transform the lives of children and adolescents. To us, we see partnerships as very critical, because it will take the combined efforts of many to urgently tackle the challenges faced by children and their families. So as we reflect, where do African philanthropists put their money in health? we've seen a number of investments in the space of health infrastructure, and this speaks to hospitals, clinics, primary healthcare. We're also looking at even community level investments. We've also seen an increasing number of investments towards emergency health relief, be it Ebola, and I guess now the most recent response being the COVID-19. Still a significant number of investments go into maternal and child health. There's malnutrition and stunting, HIV and AIDS, and reflectively we could say that these are the key areas of investments. So what is the current landscape in this giving and how does it look like? So as we reflect on today's theme, we are saying towards an equitable, resilient, transformative health system in Kenya and beyond. I must say, as African philanthropists, there is need to pay more attention to the social determinants of health. And social determinants of health are conditions in which our people are born, they grow, they live, they work, they age in. And these conditions affect a wide range of health and quality of life, risks, and outcomes. So these include factors like healthcare access and quality, education access and quality, social and community contexts, the economic stability, and our neighborhood and the built environment that we live in. So these factors, I must say, whether we like it or not, will have a direct impact on health outcomes, such as mortality, morbidity, life expectancy, healthcare expenditures, health statuses, and many others. So if we reflect on these 5 key social determinants of health, we see a growing number of initiatives are now emerging to address these social determinants of health. Some initiatives seek to increase the focus on health in non-health sectors. Others focus on having the healthcare system itself addressing broader social and environmental factors that influence health. So if we reflect onto economic stability, here we see key issues such as poverty, employment, food security, housing stability. All this will have an impact on health outcomes. When we look into healthcare and access and its quality, here we're looking at issues that would limit access to healthcare, access to primary care, health insurance coverage, and even health literacy. Then when we move into the education space, here we're seeing increased educational opportunities that would help our children and adolescents. So basically we're looking at key issues that would limit the transition from secondary school, enrollment into tertiary institutions, education levels at households, and in general, what is the literacy level and the opportunities that early childhood education presents to our communities. So the 4th objective, this being the social and community context, here we look at how well do our communities live, what's the cohesion in these communities, civic participation, inclusion, conditions even in the workplace. Arguably, this would also have an impact on health, the quality of health and the health outcomes for our people. And lastly, the neighborhood and the built environment. So in this space, as philanthropists, we should be engaging our conversations in what's the quality of housing, access to transportation, availability of healthy foods. So across these 5 dimensions, there is definitely overall now the need for partners, local actors, to integrate tools, consolidate data, develop programs for putting these social determinants of health into action. So as CIFF, what is our approach to country investments? So as a foundation, we visualize an Africa where girls have the health, the economic opportunities, and the agency to contribute to a thriving and self-determining Africa. We honestly believe that our ambitious vision will become a reality if we focus on the needs of the girls, prioritize and prevent root causes, and also equally advance locally led and owned sustainable solutions that are so well embedded in systems change. So overall, I would say that we aim to build a portfolio of investments that will be galvanized on 4 key principles. That is integration, sustainability, localization, and quality in execution. So basically these 4 key areas and 4 key principles would catalyze the momentum for locally led development. So as we reflect, and as I reflect on our investment approaches, we have 3 key driving factors. We seek to understand the demonstrated needs for our investments. We also look into the probability of success. And thirdly, and most critically, is the existence of collaborators. What is the environment for collaboration? So when we speak to demonstrated needs, we are saying and asking ourselves as a foundation, yes, we have identified selected issues that are of key priority to us. So we also look for countries and geographies where these specific issues are most prevalent. So when we speak to the girl child, we are looking at the opportunities for education, for livelihoods that could make an impact in that girl's life. So when we look at the girl's holistic life, we want to make an impact not only how educated they are or how transformed their livelihoods are, but also in the communities that they live in, how resilient are these communities? So even specifically to the demonstrated needs, we also focus on countries that are overall grappling not only with just one area, but with multiple critical cross-sectoral issues that would align to CIFF's agenda. Then also the probability of success is also important, where we really embed existing relationships, but also with the hope of building possible new relationships to build a better sustainability platform for these investments. And lastly, the existence of collaborators. Partnerships, as I mentioned earlier, are really critical to us. Let's be a bit more specific now when it comes to Kenya. What does this look like for Kenya? So as Kenya being so critical to us, and working with governments and partners also to just really bring out positive health outcomes to our communities, we actively nurture relationships with our government, not only just at the national level, but also even at sub-national level. And here we're not only just seeking to secure core funding, but to also optimize alignment on strategic priorities. So what matters to national government, what matters to sub-national governments is also very important to us. On the other hand, we are also very deliberate to invest in partnerships and basically look at how do we co-design health solutions with government agencies, with the CSOs, and even with the private sector. And how this becomes a success is how well overall our investment approach will embed integration, how we will embed localization, and also how effective our execution model is towards supporting agility and even cost correction. And lastly, we look into what sustainability models have we brought to life, and how well and how secure will the investment be beyond the period of CIFF funding. So with this in mind, I'd like to reflect on a case study. And basically this is an ongoing conversation that we have and that we are having with the county government of Kisumu. And this is basically coming in to support the county's efforts to ensure citizens of Kisumu County have access to essential and quality healthcare service. So Kisumu County Health Insurance Scheme. This was launched in March this year by the county government, and the locals happily refer to it as MARWA. And it's basically a vehicle that is responsible for the implementation of UHC in Kisumu County to ensure that citizens have access to quality healthcare services. So broadly, this scheme seeks to purchase NHIF supercover on behalf of its citizens, and also builds onto the national strategy for social health insurance. The county government of Kisumu has also exceptionally committed funds to pay NHIF premiums to a proportion of its indigent population. So we must say, when we reflect on this conversation, 4 key areas come out towards the demand side. So basically, the scheme is looking at providing sustainable cover to the indigent through paying NHIF premium subsidies. The second is also to get the informal, or what we call the self-employed sector, on board, and this is largely to curb adverse selection. Then also, we seek towards, the scheme also looks at specifically increasing care utilization for vulnerable patient groups. So these are like mothers, their newborns, to just make sure that not only are we focusing on the broader population, but also the vulnerable patient groups are of key importance to the scheme. And lastly, the scheme focuses on optimizing patient-level accountability and transparency. And this will be made quite visible through the integration of system dashboards. So when we reflect on this specific conversation towards investing into Marwa, the key important thing that this idea is really locally led and owned by the county government of Kisumu. So who we have as CIFF, we're bringing in a CIFF grantee that will provide the technical support towards this investment, but also being cognizant that the scheme needs to onboard more funders to finance different aspects of the model, with the aim that the county government will take ownership at the end of a 5-year investment. So what have been and will be the key levers to this partnership with the Kisumu County government? So 5 areas come to my mind. The relationships that we build with the county government will be equally important to the success of this investment. The knowledge and understanding of what are the key issues that the scheme would be addressing, what are its limitations, what are the opportunities, what are the risks. So knowledge is really important to us in this conversation. Thirdly, priorities. It is important to hear what the county government leadership and even its citizens are prioritizing. And also fourthly, the decision-making and how we arrive at how we move on with the investment, that decision-making also has to be owned by the county leadership. And ultimately, the delivery and execution of the investment will be of critical importance. So in an overview, Marwa as a part of an evolving ecosystem in Kisumu, on the left-hand side, it will bring the payers together. That is NHIF founders and funders, and basically these are the working force people in Kisumu that are paying to NHIF through taxation. We also look at members, and this is the informal or the self-employed population that I was mentioning. How do we bring in their contributions to Marwa? Social payers like CIFF as a foundation and any other funders. We're also looking at how do we optimize other vertical funds such as Linda Mama, which has done very well. And lastly, Kisumu County itself that has committed to subsidizing part of the payments for the indigent population. On the right-hand side, we have also the providers. We have to make sure that the health providers and patients, either from the public facilities, private facilities, faith-based facilities, are part of this ecosystem. And lastly, how we secure, how transparent we are, how we embed Marwa as a scheme for the people such that people believe in it and people actually are able to benefit out of the outcomes of Marwa is very important to us. So overall, that's how the Marwa investment would be looking in the next couple of months, with the hope that after a 5-year engagement with the Kisumu County government, the county government will be able to spearhead this investment sustainably, but ultimately for its people to achieve quality healthcare services. Thank you very much.
Thank you so much, Leah, for that perspective on philanthropic investments or in the health sector. As we prepare to move into our question and answer session, let us now watch a few more video highlights showcasing members' programs and investments in health.
The Mount Kenya University Foundation was established by the university to work alongside the activities of the university in supporting needy situations, especially situations where various students joining the university may require some support. The foundation also works hand in hand with the university in supporting the core mandate of the university. At the moment, the foundation's activity is in tandem with the Mount Kenya University's current role that has been awarded by the United Nations Academic Impact to serve as the SDG 10 hub in reduced inequalities. The foundation has been quite instrumental in supporting research within the activities of the university. Case in example is where the foundation has supported Mount Kenya University and Makerere University College of Health Sciences. The two colleges are undertaking a joint collaborative research in medical sciences, and this is sponsored by the MKU Foundation. We have seen within the last few years a number of students who have benefited from the foundation, especially students who are studying in various areas such as nursing, as well as in medical school. And these students need a lot of support because the cost involved in the training, and therefore they come to the foundation for support. The foundation also works with the university in sponsoring community outreach activities. There are a number of community outreach activities that are supported by the foundation.
Every mother in Kenya deserves skilled delivery services and ample support during childbirth. However, poor physical access to health facilities, poor quality of services, social and cultural barriers, and high cost of healthcare have denied mothers this opportunity.
As Safaricom, we are committed to ensuring that we support the different initiatives by the government, by the different development partners, and the community to improve the lives of our mothers, to ensure that they do not lose a life when giving birth.
Some of the mothers, when they leave their houses coming for delivery, they come with nothing. And you know, a newborn is so precious that sometimes they get infection.
At least 6,000 mothers from across the country have benefited from a 25.2 million shillings maternal newborn and child healthcare project funded by the M-PESA Foundation as part of Safaricom's 20th anniversary celebrations.
M-PESA Foundation has committed 25.2 million in gift packs for mothers and also babies across 24 facilities.
This is a pack that contains all what that a mother needs and all what that a newborn needs after birth.
But it's also essential to give mothers a sense of pride for having a newborn.
Mara nyingi kuna wale wanatoka sehemu za mbali na wanakuja hawana chochote. Kwa hivyo wakija atapata mama kit. Tena wale wenye wanaenda kuzalishwa nyumbani na wakunga pia wamefungua kwa sababu huduma zetu zimekuwa bora zaidi na kila mtu anatoka akiwa na furaha sana.
Nimeletewa besheni always ambaye imenipunguzia bajeti zangu na nimefurahi sana na nawashukuru.
Ninashukuru kwa maana hata kuna zile ambazo nilikuwa nazo lakini zilikuwa chache. Sasa wameweza kunisaidia kwa upande mwingine.
initiative saw women in over 24 health facilities across the country receive mother and baby packs. Each pack contained crucial items such as sanitary towels, shawls, diapers, pajamas, soaps, and a basin.
As M-PESA Foundation, also ensuring that as we give back to the community, we are also encouraging mothers, communities to seek care. And there are simple interventions that can ensure that mothers do not deliver at home, but deliver in health facilities where they can get the best care. Thus, the Mama Pack acts as an incentive to mothers to really get to health facilities and deliver. Through this, we are able to save lives.
This is a good initiative, you know. It's encouraging for every mother who is here. Hizi si vitu utapata kwa wakunga huko nyumbani ama penye utazalia huko anywhere else. So, hakuna siku nyingine utajifungulia mahali pengine. I'll always be at the hospital.
As we look now, we have had 20 years in Kenya. We're thinking about the next 20 years. And we want to go beyond. Whether it's beyond in terms of serving Kenyans, whether it's going beyond in terms of even the work that we're doing through the M-PESA Foundation and the Safaricom Foundation. Tunataka kukiuka, and we are ready and willing to be able to have those conversations that will help us keep on serving the communities that we are in.
The M-PESA Foundation has also invested in 2 large-scale maternal health projects over the last 10 years, Uzazi Salama and Leap, in northeastern, Nyanza, and western regions.
Mimi kama mama nawashukuru sana kwa hizo baby packs yenye mmetuletea, inatusaidia.
Mimi sikuwa hata na beseni, sikuwa nimejipanga na vitu kama hizo, nilikuwa tu nashukuru Mungu manake nimepata nguo za mtoto bure.
Mimi nimefurahi. Ona sina pampers nimepata. Nimefurahi, kuna sholi sijanunua ya mtoto mimi nimepata.
Because they are in their period.
If the women's parts, I'm able to concentrate in class. I'm able to build up my future.
Thank you so much to all our speakers this morning for providing us those key insights into the context around health sector in Kenya, and more importantly, what are those opportunities for the philanthropic sector to complement government's efforts and to intervene to ensure that we have equity, resilience, and transformation in our health systems. We're now moving into our question and answer session with our morning speakers. Representing the Permanent Secretary in this Q&A session is Dr. David Kariuki, who is Head of Health Policy, Research and Development in the Ministry of Health. Welcome, Dr. David Kariuki, and we appreciate you for representing the PS who had to leave us. Also want to welcome back our other speakers from earlier on in the morning, Dr. Rispah Walumbe and Leah Kibe. To kick us off, I want to get the perspectives and questions of some of our members. I can see some have been patched into the studio. So a warm welcome to Dr. Carol Karutu, who is the Vice President of Programs at Enfund. Dr. Carol Waweru, who is the Foundation Manager at Gertrude's Hospital Foundation. Professor Peter Wanderi, Principal Corporate Services at Mount Kenya University, and Mr. Sudi Biko Matara, who is the Head and CEO of MTDA Foundation. Thank you for patching in and asking questions on behalf of our members. What I will ask each of you is to please ask one question, keep your questions brief. We will ask all the questions and then we will go back to our speakers to give them an opportunity to answer. So let me start with Dr. Carol Karutu to ask her question, followed by Dr. Carol Waweru to ask then her question. Over to you, Dr. Carol Karutu.
Thank you very much for this opportunity. This has really been encouraging and very exciting. So the question that I have, I will direct it to any of the speakers, if anyone can answer. It's very specific to what the Enfund does, which is support the control and elimination of neglected tropical diseases. So I'd like to know from the speakers, as we talk about transformation, as we talk about localization and ownership, the neglected tropical disease area is one that is very poorly funded. A lot of the resources that come to the NTD sector are international and very little is local. So I'd like to understand if there is any thought or if we are thinking about NTDs and how they can be integrated. We've seen great videos on maternal child health, on education, and how can we integrate these ancient diseases that we are actually at the cusp of elimination, but we could literally go back to where we were 20 years ago if we do nothing.
Thank you, Dr. Karutu, for that question. Dr. Carol Waweru, please ask your question.
Thank you very much for the opportunity, and good morning, everyone. My question goes to any of the speakers. And I would like to find out your perspective on conducting national screening programs for non-communicable diseases. We've seen in our first world countries, they've successfully conducted national screening programs for, let's say, heart malformations, for hearing impairment. And we know that some of these conditions, once they're detected early, the overall cost of care comes down and the level of disability of children actually decreases remarkably. And I think in Kenya, we've concentrated a lot on primary health care and also on communicable diseases. But we know from statistics from the Ministry of Health that non-communicable diseases are on the rise. And I think this is a good time to start talking about non-communicable diseases in children and also the role of national screening programs. So I guess anyone can take up that question. Thank you.
Thank you, Dr. Waweru. Let me turn over to Professor Wanderi. Please ask your question.
Thank you very much. And I appreciate this opportunity. I appreciate the workshop. And on a light touch, I indicate that I am happy to be the first person of my gender to be making a presentation. So I am sure I'm going to be given a little bit longer a chance than the other person who will be asking questions because I'm representing a gender that has not been very well involved. So my question, as I was, we all requested to do, will be very simple. But I need to introduce myself and say that I am Professor Peter Wanderi, the Director, MKU Foundation, the Principal Corporate Services and Communication at Mount Kenya University. But at the same time, wish to say that where I'm asking this question from, it's at two levels. That first, in appreciating that philanthropy is a critical area in ending inequalities. Mount Kenya University is the United Nations academic impact hub for SDG 10 on reduced inequalities, and therefore I am very proud to be here because what we are doing, we are championing a very important aspect of the SDG and of the Kenya Vision 2030. Straight to my question, also allow me to introduce myself as a physical educator by profession, and also that my question therefore relates to physical education or exercise science as an intervention in prevention and preventative issues. So I would want to maybe focus on all the, not the presenters only, but all stakeholders in the area of health within the continent. And I wish to say that we have noted a lot of work and plans that have been presented today in the promotion of affordable healthcare. But my question, which is very simple, is what are we doing to promote physical exercise as a preventative priority, as well as a way of managing some debilitating conditions? Are we supporting available physical exercise structures within the communities at a continental level? And if we are doing these as a priority, how are we doing? And therefore, I make a presentation and a request that maybe in the next presentations, we need to also highlight the preventative aspect. May they be nutritional considerations, and more specifically, the physical activity undertaking. Thank you.
Thank you, Professor Wanderi. Finally, let me ask Mr. Matara from KTDA Foundation to ask his question.
Good morning, everyone. Thank you very much for this opportunity, and also for the speakers this morning who gave us very enlightening presentations. I think my question revolves around health system strengthening, and part of the question really would go to the Ministry of Health. I think Dr. Kariuki is presenting, is representing Susan Mochache. And then another question, I think related to that would probably go to Dr. Walumbe of Amref. I think for me, it goes back to, you know, what we want to do, especially in the primary health care. And we know that, you know, under the Kenya Health Policy of 2020 to 2030, it articulates a number of, you know, innovative interventions, you know, be it downstream, be it midstream or upstream, in terms of how do we improve the health of our people. And my concern is around capability inadequacies and also the sustainability of the programs that we run. We know Kenya is a signatory to a number of international instruments that include the Astana Declaration of 2018, the Almaty Declaration, UHC. And for me, I think the government at the national level has been able to do this very well. So what have we done to support, especially the counties, when we come to primary health care, which is solely driven, you know, at that level when we look at sub-county hospitals going down, and especially when we are looking at the community health volunteers, who are a very critical group when it comes to the issues of delivering health at that level. Because one of the things that we've tried to do even as an organization, is to build the capacity of the CHVs. But I see a lot of sustainability issues because we're able at this particular point to facilitate the CHVs, yet most of the county governments do not have a community health bill in terms of financing for this particular structured platform that is important in delivering health. To Dr. Walumbe, what is it that we can do and we can learn from other countries in terms of, ensuring that we are institutionalizing community health services, especially using this structure of community health volunteers? Thank you.
Thank you all for those questions. Let me turn over to our speakers, and I hope we can get them back on studio. Dr. David Kariuki, perhaps I will start with you because many of these questions are directed at Ministry of Health and to the efforts of government. So as I mentioned earlier, Dr. David Kariuki is Head of Health Policy, Research and Development at the Ministry of Health. So Dr. Kariuki, I hope we can get you in studio. There was an initial question about localization, transformation with regards to NTDs, neglected topical diseases, and what is the plan for NTDs and better integration of NTDs into health interventions. There was also a question around NCDs, non-communicable diseases, and what is also government efforts around there, and particularly around increasing national screening programs for non-communicable diseases. There was a question around preventative health. I know we've been talking a lot around treatment, but how do we also look at promotion around preventative health, particularly around affordable healthcare and interventions such as physical exercise? And finally, from KTDA, a question also to you, Dr. Kariuki, around health system strengthening, particularly at the county level. What is being done to support counties with primary health care, with community health workers, and related to that, to Rispah, what can we do and learn from other countries when it comes to health system strengthening? Over to you, Dr. Kariuki, and welcome.
Thank you very much for this opportunity. And first, I would want to pass apologies from the Principal Secretary who had to join another key meeting in terms of budgeting. We today are having the public hearings at the KICC for next year's health sector budget. Having said that, I'm grateful for the opportunity to be part of this and to represent the ministry. Initially, I would want to thank Impact Philanthropy Africa for all the work that you are doing, the good work across the country and various sectors, as we have seen in the many videos that have been shown around here. Going into the questions that have been raised, I would want to first assure everyone of government's commitment to improving the health of its people and its realization that it cannot achieve these things alone. It has to work with the people that it serves. It has to work with other people who provide resources. And Impact Philanthropy Africa becomes a key enabler of most of the intended actions that need to be taken. We would want to accelerate a lot of the activities to ensure that we reach universal health coverage as early as possible. If you know from our Vision 2030, health is a key pillar, social pillar, And much more on that is the current political commitment led by His Excellency the President in terms of the Big Four agenda in achieving health. But getting to Carol's question on GTDs, I would agree with her that we have been having challenges when it comes to NTDs and their management, and it's across the world. So together with the WHO and the UN, we have been actively involved as a country in trying to eliminate NTDs in our country. If you remember, a few years back, we actually got a certificate for the elimination of guinea worm in Kenya. We are working towards others. We also want to reduce the effects that this has on our people when you talk of leishmaniasis, when you talk of other NTDs. And at the ministry, we have a unit that specifically deals with NTDs. And we are looking at how to increase the funding for that, our own resources, and now working with organizations like what we are having here today. Together we can help, and you remember most of these actually usually affect members on the lower socioeconomic status who actually require much more support for them to be able to access medications, and together with the UNDP, we are actually also having programs to improve even at school program level and community services to bring down the impact that can be brought about by NTDs. So I would say that working together between government and organizations like Philanthropy Africa and its member organizations, we can be able to increase our local financing towards ensuring elimination of NTDs. And that also goes for the NCDs, as Dr. Caro Wawero, if I remember the name, also asked. Recently, we actually launched the National NCD Strategic Framework and Plan, which includes screening as part of the program. But I remember everything as it gets to implementation requires a bit more of resources. We may have the documents done, but getting actual on the ground and implementing requires a lot of efforts from all of us to be able to get strategic and ensure that our people actually get to receive the services that they need. One of the things that we are doing under UHC is to ensure that we have a package of services that includes screening. And as we implement our UHC policy, we are hopeful and believe that the package of services that we provide would include screening of NCDs, just like we do for other communicable diseases. So I think this is part of where we can also enhance our partnership to ensure that, especially at our lower levels, right from the community to primary healthcare levels, at the health centers and dispensaries, we are able to have regular screening for our populations, not necessarily when sick, so that we can also be able to identify illnesses early enough and prevent some of those that do not require to get to the treatment level. Professor Wanderi, thank you very much for your comments. And recently, the ministry, having worked with the stakeholders, launched the National Physical Activity Action Plan. And I believe we are going to get in touch with people like you and your organization and Impact Africa to be able to ensure that the plan is actually implemented and gets to help our population across the country. I believe emphasize that I think, yes, Sudi and brought up the issue of primary health care. Very important. Actually, Kenya, yes, is a signatory at also the Alma Ata and the recent Astana declaration. And we are working together with the counties. Remember, Kenya is at the forefront of reforms, even within Africa, for health sector, even looking at right from the political commitment that we have. And our current UHC agenda is actually refocusing our health development and implementation to the primary care services and from the community. Over the last 1 year, we have trained or updated over 70 to 80,000 community health volunteers. The national government doing it despite providing support to the counties who are the main deliverers of health services. The national government has put in extra resources to ensure community units are being formed. Actually, the target was to have close to 10,000 community units across the country. And these are being upgraded to ensure that they are maintained, to ensure that our people receive services, especially those who may not be able to afford in the event that illness strikes. So our agreement with the counties was that the national government would provide support in terms of ensuring the creation or enhancement of the community units and capacity building of the community health workers, whereas the county governments would be able to provide, stipends for the community health workers. This may not have been achieved across the country, and we are in constant discussions with the counties to at least bring them up to speed to see the importance and the need for ensuring that our community health teams are well facilitated to continuously provide this service. And we are hoping that through various legislations, both at national and county level, in terms of even ring-fencing funds that are specific for health, may help to support that. But in addition, working with the Impact Africa and everyone else in the health sector, we believe that this should be able to be implemented and achieved. I would want to stop at this point, Patricia, maybe to allow my other colleagues to also give input to this debate. Thank you very much.
See this as an initial kickoff discussion between the forum, ourselves, and the government and other partners in terms of where those opportunities to strengthen interventions in health sector. So let me turn over to Dr. Rispah, and just picking up from where Dr. Kariuki has ended and hearing the comments from some of the members. From your perspective, what are some of those trends and shifts in programming that you would advise the philanthropic sector to think about post-COVID? And you've had issues around equity and sustainability coming around. So what are some of those trends and shifts that you would recommend?
So thanks again, and excited to just get into the discussion and listening in from what people have been saying. So when you look at the trends and shifts, for example, one of the things I did mention is that the shift has really been to Southern leadership within the region to kind of set the direction and set the priorities and really set its own health agenda. And also just direct the financing in a way that is more strategic for the government, that's focused on making sure that we are working on priorities that we set as a continent, we set as the region or as the specific countries. So I think that's one of the major shifts in terms of how we direct our philanthropy. So for instance, if the government chooses to set, the neglected tropical diseases as a priority, the gap that the philanthropic sector can fill is where, many of the donors focus on very traditional models of, funding maternal health care. Not that it's not a priority, But, if they want to shift and fill in certain gaps, of course, it could be through NCDs, be through NTDs, or whichever way we can look at it. But one of the major shifts is really looking at the Southern leadership, the fact that the Southern leadership is setting the pace and setting the direction and setting the priorities. The other aspect is also, there's a very huge push towards locally grown, sourced, and even manufactured, in preparation for the next pandemic. Because one of the things we want to do is make sure that we have access to the items we need for service delivery. We want to make sure that we have better commodity security. So the biggest shift we have is towards, that's one of the biggest shifts we have, towards locally grown, locally sourced, and manufactured commodities. For commodity security, whether that's in the context of a pandemic or in the context of just generally for universal health coverage as a priority for the Kenyan government, for instance. Of course, I won't belabor the point about the focus on more robust healthcare systems that can respond to global health security threats, but that's still something that's also very critical. Then the other aspect is also the emphasis on governance and accountability. That's really going to always drive the point home. Because what you want to make sure that the philanthropic sector has, kind of like formalized processes to engage with the government that make sure that we're able to access, those resources in a very concise and strategic approach. So I think that's those are kind of like the shifts and trends that you're seeing, especially in the context of COVID-19. Just also to answer the question that, that was shared earlier. I think it's important for what we've learned from other countries is that, when it's in the context of community health workers and their importance is that, when we prioritize the work of community health workers, the impact they have in terms of especially strengthening primary health care, strengthening access to care, that's when we actually see a change. So how do we do that prioritization? It's also through making sure that we make sure that we actually include them in our budgetary processes. We formalize their employment and make sure that there's a structure that engages them throughout their tenure as community health workers. And of course, there's a formalized way in terms of the engagement process. And I'm really excited to hear, of course, the strides that Dr. Kariuki was mentioning. And then the final thing I think I wanted to just point out, just as I of course let Leah go ahead. Is also looking at, Dr. Waweru's mentioned something about, how do we look at the selection of NCDs as being incorporated as part of our screening methodologies for, making sure people have access to better care. I think one of the things that even was a challenge even for the National Health Service in the UK was how do we go about the process of selecting these specific non-communicable diseases? Because your selection process should encompass a lot of things. So, for instance, it should select NCDs that can actually be treated. So we have the methodologies to treat some of these non-communicable diseases. Two is that the outcome that when the treatment is instituted is actually better than it was if it wasn't picked up through the primary healthcare system, screening systems. But also in terms of how do we make sure that we balance on the extent of how far we want to be able to have these treatment modalities included in our process. Because as Dr. Kariuki said, funding is going to be a really big discussion in terms of how we mobilize resources for something like screening. So just in terms of how we prioritize, again, I would just, of course, seek the guidance of Dr. Kariuki's team from the Ministry of Health and, of course, to the leadership of the MOH to kind of just clearly outline what the package is, because that then now tells you how you can make sure that the impact, the impact of the philanthropic sector is actually felt, because you can identify the gaps and see how we can accelerate them, but of course focus on sustainability. So that's kind of it from me.
Thank you, Dr. Rispah. And I'm conscious of time, so I want to encourage everyone, please continue to post your questions and your comments in the chat feature, which is an icon to the right of your screens, and we will continue this conversation. Let me bring in Leah Kibe and pose to her two questions that have come in, particularly with regards to CIFF. CIFF is a leading philanthropy working in Africa, And so when you're looking across Africa in terms of the enabling environment for philanthropy, and particularly around corporate and private giving to health, what is your thoughts in terms of how Kenya is placed as a country? And related to that, again, from where you sit as a philanthropy, what are some of the opportunities that you see for co-funding by local and global philanthropies to create more impact in communities, to drive equity, sustainability, and transformation?
Wow. Great. Thank you, Patricia, for that, and really great conversations today. So reflecting from just basically this morning's conversation and being even more specific to where Kenya is, I think the enabling environment for Kenya has very different actors. Kenyans is Kenyans, us, we as individuals are part of that system. There's the private sector actors, there's the government. And I think for me, reflecting on that question, it's a bit of a mixed bag. Rightly, I will say Kenya has a culture of giving, and we have spoken to this from Madam Susan's conversation to even Dr. Rispah's comments. Our Harambee spirit transcends everything. We have seen Kenyans come through in COVID. If we remember very well in, I think, 2011, when we had the Kenyans for Kenya initiative to respond to the hunger issues in Turkana, I think that was just momentum. When we saw Kenyans actually could give $10 million, I think, was what was given through the initiative. That was amazing. So from an individual perspective and from a community perspective, Kenyans are willing to give. So now when we step back a bit now and we look at how the corporates are engaging, I think it's also quite inspiring. We now have a vast growing corporate foundation. Professor Wanderi is here representing MKU Foundation. We have Dr. Carol, Gatros Foundation. So the corporates are really coming together to channel giving towards education, healthcare, right? Even all the social determinants I presented this morning. And obviously, when you look at all these charitable contributions, they really go a long way to support what the government is doing. So when you look at the actors, we are currently engaged. We are there. We want to do good. We want to make an impact. But now, when I reflect on the right-hand side, I get the perspective that this giving is quite ad hoc. So there's one point, we are here for Turkana. Next thing, we're here for COVID. Next thing, this other tragedy we're responding to. So it's quite ad hoc, and it makes it even more difficult to be clear as far as what are the real trends and capacity to this philanthropic giving in Kenya. So we lack data, we lack evidence, we even lack matters coordination in this whole space. So when you speak to the enabling environment, on the left-hand side, there's a whole pot of money that we can really get in. But on the right-hand side now, we are ad hoc. Everyone is everywhere. And we also don't even know what the trends are. And then even when it comes to asking ourselves, what are we responding to? You know, how strong are our strategies towards the investments we want to make? I find those two as key opportunities within the enabling environment that philanthropic givers need to reflect on. What are the trends? How are we doing it? Are we coordinated? Then again, what are the strategies? If we even reflect on what we did for Turkana, we just gave and walked away. How did we effectively use the $10 million? So strategy is also very important. And I think that will be a great enabling part to this conversation. And then let's give from a systems approach. And I reflect on the question that was raised by Mr. Matara, KTBA Foundation, about the whole CHW context. CHW has been a pain for everyone. On one side, we know how critical they are to the healthcare system, but on the other side, we really know what is underlying, what limitations we have to make it very effective. to support the primary healthcare system. So if you look at the private sector actors, all the donor communities giving to CHWs, we have multilaterals, bilaterals, corporate. So many givers are going to the CHW space. We also have the government. Governments are still also quite keen in that area. And maybe this is where Rispah's question was. Should we even think of innovation? Could we think of strategic innovations that can get us to stop asking how can we make CHW model more effective and sustainable? So it could call for definitely a systems holistic conversation. So that's what I see as the enabling environment for giving in Kenya. So to your next question of where do these opportunities lie, I will say our key success drivers fall back on 4 key principles. How well are we integrated? How well are we looking at all the different factors? Also remember the conversation that Rispah mentioned earlier. In as much as we're speaking to health, there are non-health issues that affect health outcomes. So education has to come into play. As I said, our built environment, our infrastructure, we have to ask ourselves, is it having a negative impact on health outcomes? The literacy levels of our communities, the economic stability. Obviously, we'll keep asking ourselves, is health insurance really possible? In as much as we have very great models. So the holistic integration of our response is very important. And the second principle, and I would say the success factor, is the localization approach that we take. We have to understand what people need. We have to understand that ownership drives sustainability, and that we also have to respond to what is really affecting me, Leah, as an individual, and that will greatly determine how well I support the investment. Same thing with the county government. What is really limiting their success? That we really need to localize our conversation. Beyond localization, we come to how we execute. Execution is, I would say, is really key, because execution not only just says we are executing what we strategize, but it also allows us to be adaptive in how things are changing. So we're not just saying, oh, since we signed off this investment, we will run with it till the end. We need to ask ourselves, are we still achieving the outcome and the impact? Can we adapt? Are there any new elements regionally that would influence how we execute? And then lastly, we have to start with sustainability in mind. If we never spoke about sustainability during strategy development, let's forget that the model will be sustainable. So I would say those 4 key areas are quite critical, even as we speak towards investments in healthcare and even in non-health sectors. Back to you, Patricia. Thank you very much.
Thank you so much, Leah, for that feedback. And just a thank you to all the speakers and also to our members who've been asking questions. This is such a rich discussion. It's very clear this is what the forum has been created to do, provide that platform for sharing, promotion of best practices and innovations, and also thought leadership in terms of how we can amplify the corporate and private giving investments and programs in health. I know we're a bit over time, but we're very close to the end. I want to turn over right now to Mr. John Ohaga, who is a trustee of M-PESA Foundation. M-PESA Foundation is one of the co-conveners for Impact Philanthropy Africa. So I want to turn over to him to provide to us the closing remarks and help us close the workshop. I understand from studio we are trying to get Mr. Ohaga online, so just let us give him a second. And just in terms of introduction, he is a trustee for M-PESA Foundation, and he's also a managing partner with TripleOKlaw Advocates, and has been a champion in the development space. And so as we look towards Mr. Ohaga coming on board to give us closing remarks, let us just play a short video and also show the members of Impact Philanthropy Africa as we close out the workshop. Our apologies for going over time, but we will be ending shortly. Stay with us.
Every mother in Kenya deserves skilled delivery services and ample support during childbirth. However, poor physical access to health facilities, poor quality of services, social and cultural barriers, and high cost of healthcare have denied mothers this opportunity.
As Safaricom, we are committed to ensuring that we support the different initiatives by the government, by the different development partners, and the community to improve the lives of our mothers, to ensure that they do not lose a life when giving birth.
Some of the mothers, when they leave their houses coming for delivery, they come with nothing. And you know, a newborn is
Thank you to all our speakers for such an informative session that we've had this morning. And to close us out and to provide the closing remarks, we have Mr. John Ohaga. He is a trustee of M-PESA Foundation and managing partner, dispute resolution at TripleOKlaw LLP. Mr. Ohaga is a managing partner as well as co-head of dispute resolution in the leading firm, TripleOKlaw LLP Advocates. He is an inspirational leader and mentor, as well as widely recognized for his exemplary work and expertise in dispute resolution. He has stood out as the leader of one of Kenya's most enduring and leading law firms for the last 25 years, steering it from mid-sized law firm to Africa's top 50 law firms in 2021 at number 39 with 36 lawyers. It is one of only 3 non-alliance law firms from Kenya and whole of East Africa to make it to the coveted list, celebrating the 50 biggest law firms in Kenya. We want to thank him for being here with us today, and I invite him in his capacity as trustee M-PESA Foundation to give us the closing remarks and close out this forum. Thank you.
Good morning, and thank you very much for that very, very kind introduction. It really is my pleasure to have sat through this forum this morning and to listen to something that I would not ordinarily spend my morning listening to. I would spend my morning attending court or addressing a judge, and doing some other work in the legal sphere. And so just changing gears and being able to listen to something that is close to my heart, something that the M-PESA Foundation truly values, has been a real pleasure. So let me just start by thanking you for inviting me to make this welcome opening or closing remarks. I beg your pardon. And I want to start by thanking our keynote speaker this morning, Mrs. Susan Mochache, Principal Secretary in the Ministry of Health of the Republic of Kenya. I want to thank the other keynote speakers, Dr. Rispah Walumbe, Health Policy Lead at Amref Health Africa, as well as Ms. Leah Kibe, Director, Co-Funding and Partnerships, and Head of Kenya Office at the Children's Investment Fund Foundation. And so to you members of the Impact Philanthropy Africa Forum, invited guests, let me say good morning. Let me start by thanking Patricia Mugambi Mbegwa, Head of Secretariat, Impact Philanthropy Africa and her team for organizing this very important forum and for inviting me to give some closing remarks. As the M-PESA Foundation, our aim is to implement large-scale and highly impactful community projects. The health sector is one of the areas where we have invested heavily since our inception in 2010. Just talking about some of our interventions, those include maternal and newborn health projects in partnership with Amref Health Africa and Farm Access Foundation. This is called Uzazi Salama, and this has achieved a 75% increase in utilization of maternity services in Samburu and the training of over 3,000 community health volunteers. It has also led to a significant decrease in maternal and newborn health morbidity and mortality rates in Samburu County. We have also invested in use of technology to promote health service provision across the country through the M-PESA digital platform that enables people to save, send, receive, and pay money for medical treatment through a mobile health wallet on their phones. This platform, which is a partnership with Farm Access and health payment platform CarePair, also provides an opportunity for healthcare benefits such as vouchers and insurance. The award-winning M-PESA solution now has over 5 million users, close to 4,000 approved health facilities countrywide, and over 1 billion shillings have been paid out to date. And just last week, we partnered with the Flying Doctors Society of Africa, United Nations Population Fund, Amref Kenya, and International Cancer Institute for a fistula program targeting 4 counties. This program, which was officially launched in Webuye Hospital, seeks to provide fistula treatment and surgery to over 200 women in Bungoma, Kilifi, Nyeri, and Meru counties. Listening to the discussions today, I couldn't help but also reflect on the learnings we have picked up over the last decade when it comes to supporting the health sector. Perhaps the two most important lessons are the role that partnerships and technology play in healthcare. According to research, smartphone penetration is on course to reach 65% in Africa by 2025, with 27% of these devices being 4G enabled. The potential reach is more than 475 million users. As you will appreciate, this means therefore that there is a fertile and growing opportunity to deliver health digitally at scale through a combination of formal and informal services. However, technology alone will not provide the solutions the healthcare sector needs, and this is where partnerships come in. It will require key stakeholders in government, private sectors, and corporate charitable foundations, such as the ones represented in this forum, to facilitate access to trusted and intuitive digital health initiatives and products. Other than M-PESA, which I talked about earlier, a good example of how M-PESA Foundation has brought together technology and partnerships is through the LEAP platform, which is also another one of our health initiatives. Amref, the Ministry of Health, PESA Foundation, and other partners came together to deliver transformation through a simple SMS. The LEAP solution enables community health workers to gain access to the requisite training so that they can deepen their knowledge and have access to the latest information. The platform allows them to also interact with their peers to facilitate exchange of information as well as their supervisors, adding value to the community they serve using just a simple SMS and audio. As we speak now, we're in the final stages of putting together a telemedicine program in partnership with Gertrude Hospital Foundation that aims to improve access and convenience to healthcare services in rural and underserved areas in Kenya. Indeed, the COVID-19 pandemic has also opened our eyes to new possibilities in the healthcare space and proved how handy partnerships and innovation would be for citizens. As I conclude my remarks, let me also just reflect on the key points I picked up from today's discussions. Listening to Dr. Rispah Walumbe, I learned that there are lessons that we must pick up from our continent, Africa. She mentioned clear leadership, with which I fully agree, and she talked about the regional commitment to self-reliance. That, as you, of course, must appreciate now, we can only achieve through these partnerships that we are developing and facilitating through this platform. Listening to Leah Kibe, talking about the social determinants of health, integration, sustainability, execution, I listened to these and thought about how this can be implemented in the healthcare sector, as with any other sector that relies on strategy and execution to deliver best practice. And so I want to thank our speakers this morning for this kickoff discussion on health. These discussions will contribute towards informing Impact Philanthropy Africa's agenda on health. It will also inform how we, the forum members, can collectively engage with the government and other health stakeholders through concrete mechanisms moving forward. Let me close by calling on our fellow Impact Philanthropy Africa member organizations for us to come together and think about what we can do collectively to amplify our work in health and improve the social determinants of health in Kenya. On behalf of the Impact Philanthropy Africa Forum co-conveners, let me once again thank all our speakers. Thank you to all the members and partners. Thank you, ladies and gentlemen, for your time and your attention. We have now reached the end of this forum. We thank you for your participation, your interest, and your commitment. I want to say, stay safe and God bless you. Thank you very much.